Hi, folks. Welcome to episode 29 of How to Find Your Hidden Superpower: Autism, Asperger's, and those of us who are neurodiverse. So, I wanted to bring another clinical paper to you all. It's called The Misnomer of High Functioning Autism. Intelligence is an imprecise predictor of functional abilities at diagnosis. So, in previous years, this paper's produced in 2019. In previous years, people believed that autism was a predictor of IQ, in which that's not true. Uh, so, getting down to brass tacks, the abstract says that these data indicate that estimates of intelligent quotient alone, IQ, are an imprecise proxy, so imprecise measurement, indirect measurement for functional abilities when diagnosing autism spectrum disorder, particularly for those without intellectual disability. We argue that high functioning autism, also known as Asperger's, is an inaccurate clinical descriptor when based solely on IQ, and this term should be abandoned in research and clinical practice. So, the stereotypical people that are portrayed as autistic or people that have severe mental disabilities and are not able to deal with the world, in which that's not the case. Sometimes that can be the case, but not always. So I'm diving down in here. Um, so hold on one second. Sorry about that. Um, Here we go. Discussion. To our knowledge, the largest investigation of relationship between adaptive functioning and IQ at, at the time of diagnosis is this paper written in 2019. Our findings confirm that while there was an association between adaptive functioning and IQ, age at diagnosis explained the greater portion of the variance in adaptive scores than IQ alone. Because if you're diagnosing a child, at age 5, I mean, how much are they going to be able to adapt to the world? Uh, so, and also how good are they going to score on the IQ test? So, IQ is also a weak predictor of adaptive functioning, and the addition of age at diagnostic improves the predictability capacity of the models. So the older you get, the more predictable the pattern gets. But if you're diagnosing a child, IQ and figuring out how well they're going to adapt when they get older, it's not well used. Um, so previous studies compared adaptive differences between autistic and non-autistic people and consistently found overall a lot lower adaptive functioning in autistic people compared to non-autistic people. I think that's kind of obvious, but so I'm trying to dig down in here. The use of IQ as a proxy for adaptive functioning has also resulted in the assumption that functioning levels are stable over time and context. However, there have been little systematic investigation into adaptive functioning profiles of individuals with autism across their lifespan. Several recent studies have shown that when assessed repeatedly over development, distinct adaptive functioning trajectories may be observed in children with autism, where while the majority exhibit stable or worsening trajectories of functioning with increased age, Some demonstrate moderate improvements over time. These recent findings highlight the need for periodic adaptive behavior assessments over the individual's lifespan to help with understanding potential development trajectories and in planning for clinical service provisions. Uh, uh, so bottom line is you need to do more than just one test. You can't test some child at 5 years of age and predict where they're going to be at when they're, uh, you know, 25 or 15 or 35 or 55. You got to test and test and test. Despite these strengths, we acknowledge several limitations. A vary of cognitive assessments with this VABS test were utilized during the time periods this study was covered. Although we use standardized estimates, the variety of tools may have added greater risk of bias to analysis. So they're worried that even with their testing, because of the testing tools not being accurate, that they were worried that it would affect the accuracy of this study. Based on the present findings, we argue that high functioning autism is a poor clinical descriptor when based solely on IQ, and it should not be treated in current clinical or research practices to infer functional abilities. In line with calls from neurodiversity advocates, the continued use of the terms high functioning can be harmful, denying supports that are presumed to have greater functional ability based on IQ, in addition to restricting agency and autonomy to these classification as low functioning. Instead, researchers and clinicians should strive for articulate, specific phenotypes, uh, so breaking down types of autism, delineation of specific subtypes and their effect on functioning will support such change in practice. For example, specifically specifying cognitive features, presence or absence of ID, along with the language level. And ID stands for something, but I'm not sure, so sorry. Um, so, present findings suggest that researchers and clinicians should move away from binary high or low functioning categorical descriptors towards a greater understanding of the variety of functioning and cognitive profiles that manifest across the autism spectrum and the specific support needs required to maximize an individual's opportunity and potential. So the bottom line is, right, well, as of 2019, and probably still right now, today in 2022, uh, they talk about high functioning versus low functioning people with autism, in which it's supposed to be a spectrum at the very least. And if you've watched any of my other videos, I've talked about the AppsPie quiz, which looks at how autism is not only a spectrum, but it's actually a pie. And you have many different aspects in which, as an autistic person, you can be strong in certain aspects where you could be neurotypical, and in other aspects of your life you could be neurodiverse, and within that neurodiversity you're going to be have a spectrum of how strong your neurodiversity is compared to your neurotypicalness. And so it's way more complicated than the scientists realize. And with that, I think we should all be advocates for our best opportunities to learn on how we can best develop functioning social aspects of our lives, and learn about who we are. So, with that, I hope you find this educational and have a great day.